person knows it's legal, so technically I don't have to tell you.
Oh, you don't? Okay. What?
We can really get to see the real side of Dr. Gordon now. Have you speak as freely as possible. You can talk about the hookers in Costa Rica.
That's next.
You can talk about the time you and Dr. Delgado met up with the she-males in Thailand.
Oh my God. He told you all those stories back. That was 2005, February 2005.
He told me he likes to train naked in his backyard, and I go, well, does Dr. Gordon know that? Because I know he'd like to be on site for that.
No, and I didn't watch him do the Guinness record of hand push-ups either.
Yeah. You know, the joke I make with Dr. Delgado is because he holds that record in that endurance contest, right? The dumbbell curls and presses.
Right.
He goes, no one's going to beat me in this. No one can beat me in this. I hold the record. And I go, it's impressive. It's really impressive. But the thing is that there's no financial incentive for anyone to try to beat you. So if you put up a $250,000 cash prize to anyone that'll beat you, I promise you, people are going to come out of the woodwork. You give them 6 months to train for it, and they're going to smoke you because now they're incentivized. So sometimes I'm not denigrating his abilities; they're awesome. But sometimes people like to pick obscure expressions of physical performance because no one else is doing it.
Right.
Certainly not at a high level. Someone such as I hold the record in heavy Turkish or kettlebell Turkish get-ups, right? It's like, that's a great exercise, but not a lot of people do that exercise. So it's easy to move to the front of the line on something that's obscure. Now, if you do something such as powerlifting, where millions of people compete in that, now it becomes much more difficult to be at the top, to be in the 98th percentile.
Yeah, well, I'm trying to get the Guinness World Record on digging holes and filling them back up with dirt.
Well, it depends on how you define digging holes. That's open to a lot of interpretations. You got to be careful with that.
Yeah.
I heard you dug a lot of holes when you were in Vegas a couple of months ago, but I won't ask you to clarify any of that.
That was financial holes at the crab table.
Great dance moves, though. Where was that? The Venetian?
Yeah, it was at the Venetian. We made the money back at the Wynn.
That's what it looked like. It looked like the Wynn where the La Rive Theater is, down the hall from there.
Yeah, well, yeah, it was pretty disastrous. I'm saying, geez, these dice must have directions, because they'd been closed for such a long time, and it wasn't packed. It was really strange. At the Venetian, they had just distancing around the crap table, but at the Wynn, they had plastic dividers.
Yeah.
But the only thing that blew it, and I sent the email to the manager, the pit boss manager, that they did not. They cleaned up around the edge where the stick man stood. They cleaned the dice that you were throwing. They cleaned the stick. They cleaned the edge and so forth. The only thing they didn't clean were the chips that get handed to everybody. Yeah. And I said, all you need to get is a $20 black light and have it over the area and just have it constantly. When the chips come in, the tops get, they get exposed to the black light, UV, and it kills everything, within 4 or 5 seconds or whatever the stats are. But I sent it to them.
No one's touching, no one's cleaning the chips, no one's cleaning the cash, everyone's touching that, but they're not wearing gloves, the dealers.
Yeah. Oh, no, the stick guys are wearing gloves. We're not.
Okay. I played blackjack, but I've only played locally so far, South Point and M and so forth. And there it's a little bit less restrictive. They don't have the plexiglass dividers.
Right.
And you have to wear a mask at the table, and it's about 3 people per table, so they have certain limitations. But the dealers, as I recall, they weren't wearing gloves. So they were dealing with that cash with their bare hands and dealing with chips. If I recall, I may be wrong about that, but I'm pretty sure they didn't have gloves.
It was probably skin tone gloves, so you didn't see it. Who knows?
Yeah, it could have been.
But, yeah, it was an interesting experience. There were 9 people in our party, and we can only sit in 6 maximum per table, so we had 4 and 5. And then we pissed them off because we'd get food from ours. Like we went to one of the Chinese restaurants we picked up and brought it to the other table. They said, you can't go to the table. They're our family.
Yeah, it's absurd.
And in our patient population, 2,800 civilians and 353 military, not a single one has gotten sick. And two friends outside the active patient group got sick. One of them works with my youngest daughter, Rochelle, and he started getting sick on a Wednesday, and then he was hospitalized on a Friday. He couldn't breathe, was having difficulty even talking and walking, got hospitalized at Kaiser, and then he gets discharged on Sunday. And he's admitted to the hospital Friday, gets discharged on Sunday, and told it'll take him about 2 months for his lungs to clear up. The doctor says, I'll call you in a week. He calls him in 6 days, and he's talking to the guy, and he says, how are you feeling? He says, I feel brand new, like absolutely nothing's wrong. And the doc just flipped out. So what he never told him was, he works with my youngest daughter, who's on quercetin and zinc. She gave him that Wednesday 1,000 milligrams of quercetin twice a day with 30 milligrams of zinc. So he took it on Wednesday, Thursday, Friday, got hospitalized. He took it Saturday, took it Sunday, got discharged, continued taking it for 14 days, and he was perfectly normal. He went back to work 5 days after he was discharged from the hospital. The doc freaked out. But you just look at the science, you know. Quercetin works the same as hydroxychloroquine, the same as EGCG from green tea extract, bismuth. And no one asked, what in our nutrition can protect us? No one's talked about. In India, 1.3 billion people. The United States has about 340 million people. How come they only have 85,000 deaths in the entirety of India? And the reason is because they eat legumes, nuts, shellfish, no red meat, and they all have zinc in it. And then they take a very high potency product to carry the zinc into the cell, which is called turmeric.
Yep.
Curcuminoids. Curcuminoids are ionophore. Ionophore is the term for a protein or a carrier that takes charged particles like magnesium or zinc or copper into the cell. We need to transport it with a transporter, and it's called ionophore from the word ion, and phore is to transfer or to carry. Yeah. So an ion transfer mechanism. And that's why you don't get sick.
I've been on that stack of quercetin, zinc, EGCG since the very beginning of this, since talking to you when the lockdown first happened. And honestly, I'm not worried about this COVID at all, honestly. I feel like I'm doing everything right to stay healthy. My respiratory system is at the best it's ever been. My cardiovascular system is at the best it's ever been. I feel healthy and I'm sleeping well. I'm taking all the right supplements. I'm eating well. So I'm not worried about it. You know? And I think that the problem, what amazes me is how little people know about the basics of health, good eating, optimal supplementation. I mean, you're a grown person and you still don't know how to eat properly. I mean, wouldn't that behoove you as a grown person, especially a grown person with kids, because now it's your obligation to teach kids how to be healthy, but you have no clue how to be healthy yourself. That just boggles the mind to me that people have this fatalistic attitude of, I can't do anything about this. So I'm just going to wait for the vaccine. I'm just going to wait for the government or some official to tell me what I should do. I'm not going to do anything to take charge of this situation myself.
Right. So let me ask you, how many articles do you see in the news, aside from all the political bullshit that's happening? How many articles do you see where they talk about the benefits of vitamin D against COVID, or zinc, or quercetin, or EGCG, or the fact that exercising and eating correctly, minimizing your sugar intake so you don't get glycation cross products that cause inflammation, that diminish your immune system, or the fact of some of the very easily available pro-hormones, or hormones really, like DHEA, pregnenolone, have incredible benefits on the system.
Right.
No one talks about it because, you know what? Because our system is set up for pharmaceutical, 100% pharmaceutical. Oh, you don't have to exercise or change your diet until you get diabetic. Then when you're diabetic, we put you on these 15 drugs, and you start considering not drinking Coca-Cola 6 times a day, or orange juice, but to, have good water to hydrate yourself and flush out all the toxins in your system. I mean, this is the problem. The reason for not being more preventive is because the benefits on the financial outcome are greater.
Right.
You know, why don't they have, I mean, they were able to develop a vaccine or a treatment protocol for hepatitis C.
Yeah.
So that in 86 doses, hepatitis C is gone in some 90 some odd % of the cases. Why couldn't they have done that for AIDS?
Right.
Or some of the other viral infections that we have?
Right.
It's just not financially feasible, you know? So it's the culture, the society, the financial culture, and the society that needs to be awakened about, you know, there are things you can do so that you don't end up with this, and that. Okay?
Right. Well, in the media, if they do mention any of the things that you brought up, it's always in a derogatory manner. It's always, oh, everyone's talking about vitamin D, but there's no proof that it helps, even though there's thousands of studies on the connection between vitamin D and the immune system and so forth. And then there's even studies coming out of different, not studies, but information coming out of hospitals where they've looked at the death rate among people with very low vitamin D versus very high. And the death rate is much lower with high optimal levels. In some cases, not even optimal, just in range. But the ones that are below range, the death rate is way higher. And that kind of information's come from a few different hospitals around the world that have no connection that I'm aware of. And things such as quercetin, though, that's never been mentioned. Even hydroxychloroquine, which has been shown to have merit, even that's been denigrated, saying, oh, it's not effective, even though there are several doctors all around the country that have had a lot of success using that with patients.
Yeah.
Even when there's
a 200.
Yeah.
Yeah, there's a 200,000 person post-treatment retrospective study looking at people who were put on to hydroxychloroquine, which is an ionophore. It carries zinc into the cell. That's its function. Yeah, it does have some secondary things, just like quercetin has diminished inflammatory cytokine. Vitamin D drops the cytokine storm. And that's why it's been so effective in our patients with traumatic brain injury, because all the sequelae, all the consequences of whatever form of trauma they had, blast trauma, repetitive gunfire, IED, ABC, whatever they're around, elicits a immune response of dumping these cytokines. So I've been calling it cytokine dumping in our TBI cases in our military, and they're calling it cytokine storm because of COVID eliciting it. Wonderful. They're exactly the same thing. And that's the bottom denominator, is the fact that these inflammatory chemicals called interleukins or cytokines or chemokines create the inflammatory milieu that the brain sits in and leads to disruption of biochemical pathways, so that the control mechanisms, the governors, shall we say, that control our response to situations around us, so we don't have these hyperbolic kind of responses with, you know, panic attack and anxiety. Those regulators are lost, and that's through the GABA A and GABA B receptors. And then you get stimulated by dumping of calcium, and that's where ketamine works on the NMDA cells, which are the stimulant ones. It helps to regulate them so that you're not as hyper in the brain and get bipolar and obsessive compulsive ideation and thoughts. So we have to look closer at these inflammatory cytokines that are also responsible for Alzheimer's, Parkinson's, ALS, MS, just a whole litany of medical conditions. And then what I've been doing for the past 3 months in my practice, when we discuss lab results and we go to vitamin D, I start asking the patient, so how many articles about COVID-19 and vitamin D protecting you from it are out there? 4, 5? Well, there's 76,300 articles. How about vitamin D protecting you from as a cancer prevention? And they say, oh, 500, 1,000. Well, there's 1.8 million.
Wow.
Okay, heart protection, 1.92 million. Anti-diabetic, on and on. Inflammation in the brain, some 6,000. The direct relationship between vitamin D and depression. There's 101,000 articles talking about it. And the thread that goes through all these topics is inflammation. So what vitamin D does is it helps mollify, if you will, the hyperbolic response that the immune system might have. Oh, it also helps with allergies. Also helps with allergies. And another thing that does it, DHEA and DHEAS. And, to get on topic, there is, and I'm going to share my screen so you can see some of these articles, which are, from major institutes, like this one here from Massachusetts Institute, from Harvard in the Male Massachusetts Aging Study, where they actually show that if you're deficient in DHEA, and these are called quartiles. What quartiles are, quarters, the lowest 25%, 0 to 25, then 25 to 50, then 50 to 75, and 75 to 100. In the lowest quartile, black means death and gray means heart attack with hospitalization for IHD, which is ischemic heart disease, heart attack, where the blood flow stops and you get a heart attack. Yeah. So looking at the lowest level versus the highest level, where I keep all our patients in a prophylactic therapeutic range, their death rate, there isn't any. Right. And their heart attack rate significantly decreased. And then you have DHEA, which is the one you take in by mouth. It gets converted partially or some of it into something called DHEAS. S is sulfa. And when it's DHEAS, for a lot of our hormones in the brain, it is activated. So looking at the activated form, when you're the lowest level of the activated, you have the highest amount of death and the highest amount of heart attack with hospitalization versus having the highest level of DHEAS and that amount of death and the lowest amount of heart attack with hospitalization. Right. So below the neck, what DHEA is responsible for is protection of the heart, IHD. It stimulates wound healing through estradiol receptors. So estradiol, good healthy levels, as we talked about in our last session, was beneficial in wound healing. Also neuroregeneration for neuroplasticity. Below the neck specifically, it helps stabilize glucose and in diabetics, in muscle metabolism. So if you're looking at making sure you have optimal levels of glycogen in the muscles so you can have better endurance and energy for muscle, you have to make sure your testosterone and DHEA levels are great because they activate the signaling pathway that gets the insulin to open the cell to allow glucose to go in. We have 17 cases of type 2 diabetics that are no longer diabetics by looking at their labs, their hemoglobin A1C, their fasting blood sugar, their fasting insulin levels. It's all gone. Years of being diabetics, it's all gone by replenishing 5 products. Testosterone, DHEA, and vitamin D are 3 of them, okay? So that's the benefit there. Also, benefit is here, serum DHEA levels are associated with lower risk of type 2 diabetes. This is the Rotterdam study, okay, from 2016. And the conclusion, DHEA serum levels might be an independent marker of type 2 diabetes. So if you have low DHEA levels, and for us, low is less than the 50th percentile. We try to get it in the 75th to 100th percentile, staying within the normal range, but in the upper quartile for the obvious benefits. Yes. And then, here it talks about DHEA level and the activated form and how they're inversely associated with the risk of type 2 diabetes. Inverse means when one's high, the other's low. So when DHEA and DHEAS are high, risk for diabetes is low. Right. When DHEA and DHEAS are low, risk for diabetes is high. That's inversely related. They're opposites, like a seesaw, okay? So, and these are just some great articles, which I'll put together a kit of these and send them to you. Also, I'll mount them at our website. Also, let's see, under stress. Everybody is under stress right now. I have in our patient population, a lot of our guys that are taking a step backwards in their quality of life in terms of anti-depression, anxiety, and so forth. And that's partially from watching and listening to all the stress that's generated and anger that's generated on the news relative to politics and COVID and so forth. And I'm telling all our people, stop listening to the news, okay? Or else do what you're doing. You listen to 20 minutes on one of the channels that doesn't have commentary or slants it left or right or left or in the middle, whatever. And the reason for it is when you have elevation in cortisol due to stress, your DHEA drops. And when DHEA drops, you become more depressed because the regulatory mechanism that DHEA has. In a major study that was done in, I think, 94 by Dr. Morales, he found a 30.1% reduction in depression with optimal levels of DHEAS.
No question. Just on a personal level, I've noticed the higher my DHEA levels, the better my mood for 100%.
Yeah. And this is, I was hired by an organization to develop and to give a lecture on DHEA and pregnenolone because, you know, for 15, 20 years, I've been promoting that when you're on testosterone, you absolutely need to be on DHEA and pregnenolone or else run the risk of having the secondary effects of lack of DHEA and pregnenolone.
Do you think that's also important when you're using something such as Clomid as your testosterone booster? Is it still useful to get on DHEA and pregnenolone in that case, or is it based on your levels of both, I would imagine?
Well, I'll take it from your first statement. Yes, one would assume that the use of clomiphene citrate to increase luteinizing hormone, which is the key regulator. I'm just looking for that slide. It's the key regulator of generating pregnenolone, and pregnenolone, the mother of all hormones, ends up going to become the downstream hormones, DHEA, testosterone, estradiol, estrone, progesterone, cortisol, and so forth. So when you use the clomiphene citrate, one would assume that the level of pregnenolone should go up. But what's always happening is a feedback mechanism where, you know, as you stimulate, it feeds back on itself to shut itself down.
Right.
So on the first part, so what we do to avoid challenging the system is we do put in DHEA at nighttime, because one of the benefits of DHEA, and I was trying to find all those benefits, the benefit of DHEA is that it goes to testosterone, DHEA drops, you know, depression. I mean, let's see, where's the slide? It's a neurosteroid in the brain, helps modulate inflammation. That's the cascade from cholesterol to pregnenolone, pregnenolone to progesterone, deoxycortisol to cortisol, and then to aldosterone. And then on the other side, it's pregnenolone to DHEA, DHEA to testosterone, testosterone to estradiol. And that's all the mechanisms by which it works. Let's see, I think I'm coming up to it. Well, the point being is how important having healthy levels of luteinizing hormone, unimpeded and unreduced, avoiding negative feedback, how important it is to maintaining both above the neck and below the neck functionality.
Right.
That's really the key.
Right.
That's really key. So it's like everybody, the analogy I've shared with you in the past is, okay, we're like a car with 4 tires, you know, both upper arms and lower legs, and we're driving through life. Let's say all 4 tires are flat and you get to choose 1 tire to fill. So we filled the testosterone tire, and we've got 3 of the other tires that are empty, and you're going to drive level through life? You're going to be perfectly balanced? No. You need to have all 4 of the hormones, which are, you know, the thyroid, testosterone, and estrogen on one, DHEA and pregnenolone on the other, that become, and, you know, thyroid cortisol really is what I should have said. Right. And you need all 4 of those for the balance. And then the back spare tire is vitamin D. Everybody calls vitamin D vitamin D. It's really a byproduct of cholesterol, so therefore it's a hormone. Anything that comes off of testosterone is called a SECO, S-E-C-O, steroid or SECO hormone, implying that it came off of cholesterol. And CoQ10 comes off of cholesterol. Also, RAS, that regulates cell replication, comes off of cholesterol. So anything we do to impede cholesterol's presence in the body, blocking it or whatever, leads to a deficiency in these functioning aspects. And studies have come out showing that people who are on statin drugs for lowering cholesterol, their cells die faster than a person who's not on statin, because cholesterol is used to fix the membranes of the cells. If you don't have a means of repairing the bilipid layer, lipid cholesterol layer of the cell membrane, what happens is they get holes in it and the cell dies, or it triggers a process of cell death, apoptosis.
Right.
That's basically it. So looking at DHEA stimulates the immune system. I think I had a slide, immune system, pregnenolone, no, it's psychiatry.
Well, doesn't that DHEA convert into not androstenedione, but I think it's androtrione, something like that?
No, it does go to androstenedione, which is 81, which is, that product that used to be out there. It becomes androstenedione. There are two pathways that DHEA can go. Through one of the pathways that I call the left pathway takes you from DHEA to androstenedione to estrone, E1. On the other pathway, it takes you from DHEA to testosterone to estradiol. Right. And then estradiol and estrone ping pong back and forth. They go through a sulfonated and they can convert to each other, which is great. But in a small population of our patients, what we see are these people that have a very high level of estrone and a low level of estradiol, males. And what that tells us is that they genetically or hormonally or enzymatically, because of genes, preference the left pathway, so their testosterone will be lower than optimal. Right. Because it's being diverted to the androstenedione and estrone, and you see estrone levels elevated. And the use of 7-keto DHEA stops that. 25, 35 milligrams once a day is all you need. And when we see that pattern, I don't see it very often, we don't give them testosterone or estradiol for the females that have that. We just give them 7-keto, and what you see is the testosterone goes up because it's no longer being diverted to androstenedione. Right. So it's, understanding the biomechanics, it's one of the hydroxylases, one of the enzymes. And I've been trying to find some articles that clearly showed genetic predilection towards this process. But we've seen it, the exact same thing in heavy metal toxicity. Our guys from Bragg are the guys who have close quarter combat or are shooting thousands of rounds off, and they get the vapor of mercuric chloride from the primer and then from the muzzle, from the exhaust of the muzzle as the projectile goes out, the bullet. It spins through the turns and vaporizes some of the lead. And that lead gets inhaled along with the mercuric chloride, and they poison the enzyme that allows DHEA to convert to either pathway. So a common pattern that we see is someone has a DHEA, not on DHEA, but they have a DHEA level that's 700, 900, 600, wow. And their free testosterone level is 4 or 5.
Wow.
So we know that DHEA in a healthy environment will convert to supply you with the testosterone. So what we do is these guys get on chelation therapy, they get on nutrition, saunas, the nutritional aspects, reduced glutathione, some of it, infrared light, all the things to naturally try and eliminate their toxicity. And as you get the urine mercury, 24-hour urine mercury and lead levels as they come down, you start seeing that their enzymes start to recover. Okay. Right. But it takes a long time. And, most of the guys that I see, they've been sick long enough, they want to get better yesterday. Right.
Exactly. You don't want some protocol that's going to take 90 days to start manifesting benefits when you feel horrible and you felt horrible for a long time.
Yeah. So what we do is a middle of the road kind of approach. We, that's how we ended up with the Clomid and the blended testosterone. And, we have a large population of people that started on the Clomid, and some of the people we were able to define that they had either a central problem where the Clomid couldn't stimulate the pituitary to make luteinizing hormone, which is a tertiary level, the brain, central, and another group where we couldn't give them Clomid because their Leydig cells, their testicles, were not able to make testosterone because the cells called the Leydig cells were dysfunctioning. And you can have Leydig cell syndrome. You can have dysfunctioning. I have one of our vets who IED blew up right under his Humvee, and the shock wave and the blast wave actually traumatized his testes, so they were non-functioning. So when you put him onto the Clomid, you saw the luteinizing hormone going up 14, 15, and his testosterone level 0.
Wow.
Yeah, and Clomid doesn't work for those people, and that's the purpose of using Clomid, as well as in the laboratory testing, checking out the 3 levels of influence for testosterone production. The testicles themselves, so you look for testosterone, free and total testosterone, total is worthless. And then you look for luteinizing hormone, follicle stimulating hormone, then you look for prolactin. Anyone who's had traumatic brain injury is prone towards the hypothalamus losing control of prolactin. Hypothalamus sits above the pituitary and tells the pituitary, don't make prolactin, or make a little. But when you lose that, shut down influence of the hypothalamus from blast trauma or brain inflammation, post-surgical brain tumor. We have 3 people who had brain tumors. This was their pattern. Prolactin goes up, shuts off luteinizing hormone, so you can't stimulate testosterone production. And then the third one is low testosterone, high luteinizing hormone. That's because of testicular dysfunction or primary hypogonadism, which is really Leydig cell dysfunction. The cells responsible are not functioning. In a small population of guys that have this pattern and low zinc, the zinc was the problem for it, because zinc is extremely important for both cells functioning. The Leydig cells to make testosterone and the Sertoli cells to make sperm. So by replenishing zinc with ionophore, and that's how we started using quercetin and quercetin EGCG and zinc citrate as a means of improving things. It takes a longer period of time, but the point is, how many people will raise their hand and say, I want to be addicted to testosterone for the rest of my life, versus, can you fix my own system?
Right. I mean, I would definitely go with, let's fix our own system. A lot of people would say, I'll just get on testosterone so I don't have to think about it.
Yeah, and then down the road, they realize what a mistake.
Yeah, absolutely. You should always try to optimize your own endocrinology before going for any other intervention, no doubt.
Right.
But that takes, I mean, I like your approaches. We're going to do some things right now to kick you into gear, but this is the long road of where we're trying to get. I think that's a balanced approach, as opposed to you're 28 and you have low testosterone levels, and we're not going to look at your lifestyle or your diet or anything, and we're just going to put you on TRT, and now you're on that for the rest of your life, and you never determined what the underlying cause was.
Yeah, and I think that the modern male that reads is starting to want to have a higher level of understanding of what's going on with their system, not just a knee-jerk, your testosterone's low, put you on it. One of the scariest things that I see, and maybe this is a societal type, not secret societal approach, is let's get all the guys on testosterone so they can't have kids. You know, let's just fuck up their ability to be creative, you know, and give rise to healthy American. You know, let's fuck that system up. Let's give them testosterone. And that's what I think about, you know, in jest, because I can't believe a 19-year-old male, healthy male, who had head trauma, and the doctor puts him on to 200 milligrams of testosterone cypionate every 2 weeks, you know, and the guy does well for 7, 8, 9 days and then crashes for the rest of the days, because his body, you know, they talk about half-life. Well, in addition to half-life, you have to look at biological half-life. And then beyond biological half-life, you got to look at the unique individual and how their body utilizes things. I was taught this by, you know, taking care of some very physically fit guys outside of their professional sports, where because they had such a high level of physical activity, they burnt through their testosterone. I never saw that before. I'm talking about maybe 15, 16 years ago when I started looking at it. And nutrition influences, alcohol influences it,
Right.
marijuana influences it, cocaine influences it, all the psychotropic medication that you're on influences it.
Right.
So you have to take into consideration all these factors when you're looking at, okay, how should we cycle you? How often should you be cycled on it? And what we ended up was with a low dose 72-hour protocol, which took many years to come to the decision after having large groups of guys volunteer to go on to these patterns. And you see that they do phenomenally well.
Yeah.
40 milligrams every 72 hours using a little needle that came off of Dr. Eugene Shippen's work.
Okay.
That you don't need to be deep intramuscular, and you can be superficial. He likes the abdomen fat, and I don't like it. I just right to the thigh.
Makes sense. Why is it such a big needle and an aggressive dosage once a week or once every 2 weeks when you could get an insulin needle and just give yourself a smaller dose, maybe 5 days a week, 2 days off, or even every day?
Yep.
That would make a lot more sense. So you have a stable level rather than this roller coaster ride of you get the shot, testosterone goes through the roof, you feel great for a couple of days, and then it's down low again by the end of the week, and then boom, you get another shot, and you're up.
And then you look at when their personalities become the worst. The day they get the shot, they're rude. We've had, in a study I did on our oral testosterone called Testosterone, that hopefully I'll get back to the drawing board and do it. We had 140 people that went on it. In the 140 people, 2 of them developed panic attack within 30 minutes of being put onto this testosterone. And I had to go back to the books to find out what the mechanism was. And it turns out in people who rapidly absorb into their brain testosterone, free testosterone, it gets converted down a cascade, leading to the stimulation of a chemical in the brain called adenyl cyclase, which is like putting speed in the brain. So in people who develop those hyper personalities using testosterone, that's the mechanism. And what their brain is trying to tell them is lower the dose, lower the dose. Because you can spike, when you get your shot, you can spike your level of adenyl cyclase, which creates cyclic GMP that really does the problem. But adenyl cyclase is a good stopping point. And all you need to do is lower the dose, increase the frequency, between it. In our group of people who are on 40 milligrams every 72 hours or 3 days, within 4 to 6 months, we have to start lowering the 40 milligrams to 30 milligrams because they start accumulating it and they start reservoiring it. And their levels at 4 to 6 months are much higher than where they started. Well, I mean, in the beginning, because it accumulates.
Wow.
So, yeah, these are patterns that we've been seeing. I don't write about it. I discuss it when I give my lectures. But because I have such a large population of people and we do frequent comprehensive laboratory testing, I get an understanding of what's going on, what's possibly going on with the individual. And then we take, the MPQ, the monthly program questionnaire, where they talk about how they're feeling. And you see this improvement in sleep, libido goes up, their endurance and their ability in the gym goes up, and they're not using 200 milligrams a shot.
Right.
40 milligrams, 30 milligrams. I've got guys who are on 20 milligrams and doing phenomenally well psychologically and physiologically. Spiritually, I don't know because they don't share their scotch with me. Okay. The only a good spirit. Anyway, so, these are some of the tangential things that we look at.
Right.
I run a large, basically clinical research center, and that's where we get a lot of this information on vaginally used hormonal replacement therapies as opposed to topical, lower dose, better absorption, less side effects, lower dose, therefore less side effects.
Is that the optimal delivery route for testosterone for women, a testosterone cream? Vaginally, isn't that the ideal?
Yeah, we started in 2007 developing a PLO, which is a phospholipid product, with one of the laboratories, compounding laboratories in San Diego that we work with, and had first patient was obviously a female. She was a nurse, And we started using on she and her girlfriend and started monitoring things. And we kept on lowering the dose we were giving them, and they were getting super levels. And I've got a gal that just got her PhD in kinesiology after traumatic brain injury, where she was totally incapacitated for 18 months. Her doctors couldn't figure out what to do. And we put her onto a cyclical, simple one product, cyclical blended hormone with estradiol, estriol, progesterone, and testosterone in it. And she's having regular menstrual cycles, cycling it like birth control pills.
Wow.
And yeah, and the ultrasound shows her uterus. Everything is looking great. And she's been on treatment with us 5-6 years. And she was 18 months, multitude of medication, incapacitated, dropped out of her PhD program. She just sent me an email. She graduated with honors, in her class, just going to take her national boards in her project or whatever the board is. But the vaginal approach is super.
Absolutely. I mean, theoretically, a couple, a man and a woman who are both on testosterone cream, the man could put the testosterone cream on his package, and then insert in his wife or girlfriend's vagina, and then they both get optimal delivery.
Yeah. Well, that's funny.
I think that should be part of the
It's funny because a lot of the women become very sexually active when they're on protocol.
That's right.
And the only thing I don't like is when they come in, they tell me graphically how their sex life has improved. I said, I don't need to have the graphics.
Those conversations.
Yeah. Honestly, I had to go back and take some classes on human sexuality because I was getting it was a little bit TMF, or TMI, too much information for me. So now it's okay, whatever. And then having 3 daughters, So what can I tell you? But the benefit of the topical or the intravaginal is the fact that it is absorbed so well in such small concentrations, so there's no residual. And if their male partner is exposed to it, it's only a benefit.
Yeah, exactly. That's where I'm going. It's a positive.
I heard you, but I think I might have shared it with you. The project we did with a Dr. Abraham Kruget up in San Francisco, who was sharing with me the fact that the application, he was doing a project in San Francisco, the application of this PLO testosterone 10% onto the testicles and the shaft caused an increase in growth in the penis.
Oh, really?
And I basically challenged him on that. He says, try it. So what happened was I started putting some guys that, why not? Try it. And the mechanism is so simple. What happens is DHT, there are studies about DHT and opening up coronary arteries.
Right.
In people who have, narrowing of coronary arteries in University of Michigan, I think it was, that they did this study. They were squirting testosterone into the coronary arteries and they dilated. They had conversion because of 5-alpha reductase in the blood. They had conversion of the testosterone. They dilated. Well, what happens in the cavernous corpus callosum or cavernous sinus of the penis is that the blood vessels dilate, and in their dilating, they cause stretching and enlargement and engorgement of the penis. So we measured 3/4 of an inch, 1/2 to 3/4 of an inch in girth, and 1 to 1.5 inches in length in the guys that were on it. And one of my close buddies, African American cop, came into the practice, and he was interested in learning about all these things to enhance sexual performance and so forth. And I looked at him, I said, look, I don't mean to be prejudiced, biased or whatever, but, your sex must always be great. He says, you're looking at my skin as a cause? I said, no, I'm looking at the smile on your face. Every time you come into the office, you're smiling, your beautiful wife and everything. So he ended up trying the different things, Caverject, Viagra, Cialis, Levitra, until we finally got to the cream. And he came in one day and he just bowed. He said, that's the greatest stuff. His libido went up because DHT helps with libido in the brain. Yeah, estradiol helps with, Decadic from using nandrolone decoinate and using Anavar and Winstrol, which don't go into the brain and shut down your luteinizing hormone, so you can't make free testosterone. So we know you need free testosterone to get into the brain to convert to DHT. And if you don't have that conversion in the brain and you're locking all the DHT below the neck because it doesn't get transported passively into the brain. So you starve the brain of DHT because you're not making free testosterone, because the effect of nandrolone decoinate, Anavar, mastrolone, all these DHT congeners is they have 300% greater suppression of luteinizing hormone than testosterone. That's why you shut down the testicles greater when you're using those products, the DHT congeners. Okay?
I see.
And that's why you need to be on clomiphene. And that's the message for the past 10 years is, I don't care what anabolic steroid or hormone or steroid you use, doctor directed or not, you need to be on Clomid to protect yourself. Well, I'm going to take it after in recovery. No, you want to take it concurrently.
Yeah, it never made sense to me that you wait for things to crash and then you do something about it. Yeah. It's like for your car to break down completely, then you take it to the shop. Well, why some maintenance work along the way so that we avoid our radiator blowing up on us or getting 4 flat tires? Let me check the air pressure on my tires every once in a while so I'm not on a road trip and get 2 flat tires because of my negligence.
And the simplest one is leaving from where you are in Vegas, coming into Los Angeles, and all you have is the red on your gas tank, you know. and you're going to drive it.
There's some long stretches on that road where there aren't any gas stations for a while.
That's right.
Mistake.
So what do they say about an ounce of prevention?
Yeah, exactly.
And what happens is the Leydig cells, the dysfunction we talk about, can be either a genetic predisposed or one that we created by scarring of the Leydig cells from the Leydig cells not having the stimulus of luteinizing hormone to maintain their good health. What happens is they scar, they atrophy, and they're gone. Okay. Now, I was on injectable testosterone for 17 years. You know, I had 3 hormone deficiencies from 6 head traumas, and that's what led me to the beginning of this pathway that I'm on. Right. And after 17 years of being on injectable, we did in 2014 the start of the 3-year veteran study using Clomid for reasons I won't get into. And what happened was after the first year, 2014, January 2015, I was looking at the results in bulk, and I'm saying, wow, I stopped my injectable and went on the 50 milligrams every 3rd day, just like they were on. Right. It worked, but not very well. And the reason was I had wiped out a portion of my Leydig cells, not totally, because I was only on 60 milligrams once a week of testosterone. I respond very well to the blended testosterone.
Yeah.
So what I have to go on to, and I just got finished taking my Clomid this morning, every other day. Every other day works phenomenally well.
Okay.
For me. Yeah. And we have other guys.
Fine tuning things. I mean, the every 3rd day approach definitely works well for me, but that was a couple of years ago that you recommended that. So who knows? You know, maybe now I may need more frequency. It's hard to say, but I feel good. On that.
Yeah. The only reason why you would need a shorter time frame between dosing is if the something you're doing leads to more dysfunction of the Leydig cells. Okay. If you haven't done anything to, you know, worsen their status, that's it.
If I'm taking anabolics, then maybe I would run it more frequently during that cycle to avoid.
So Monday, Wednesday, Friday, or just every other day to protect you. It's about protection. You know, a lot of times, I mean, back, in the late 80s and 90s is when I was only doing recovery for all the guys that were being referred to me. A guy by the name of Tim that I'd met when I was doing urgent care came in with all the side effects of high abusive levels of anabolic steroids from Brazil. And, you know, as much as I chewed him out, I was a little more compassionate than the other docs he had seen. And we developed, till today, you know, it's been 24 years. No, it's 86, 88, 86, 86. Long time, whatever that comes out, 24 years. No, 34 years that we've known each other. So, he started sending his buds who were in the bodybuilding arena, and we'd get them back up and running with HCG, but HCG didn't work all the time.
Right.
Beta HCG didn't work, and then mixing together Clomid and beta HCG helped a little better. Not everybody recovered. I've had enough that they just wasted their system. And we have never had a problem with any of our people who are on Clomid to start, and then we add the testosterone in.
Right.
Okay. Right. In the beginning, I perceived, wrongly so, because I couldn't find any documents, any research to help show me what to expect. I thought that age was relative to how they responded to Clomid. Turns out not to be true. I've just started with a 3 months into a program with a 31-year-old on 50 milligrams of Clomid every third day. His total testosterone, which is junk, went to 1,328. Yeah. And his free testosterone on your scale is about 320.
Wow.
I looked at that. I called him up. Well, the minute I got the results, I called him up and said, okay, are you using Clomid every day? He says, no, I'm using it. Veteran. No, Captain, you told me to do it this way. I'm doing it that way. So he's doing it, and unbelievable. I've got now 12 guys who are either on one tablet a week or on 25 milligrams every third day, as I put him on. Yeah. And just phenomenal response. And that tells you how healthy his ability is to make testosterone. And the problem, what this thing sealed for me, is the reason why he wasn't producing luteinizing hormone was because of central problems. His prolactin was normal, his luteinizing hormone was low normal, and his free testosterone, total testosterone at beginning was, I think it was 6, and his total was like 329 or 323. So really low. Okay.
Huge increase then.
Really low. Oh, we've seen, and that's why I'm a great believer in Clomid, because I have such a block of information. I'd love to, write an article with all these guys in it, to show the pre and post in 90 days. We do initial lab, 90 days, 180 days from the beginning, and then 360 days from when they started. So at 3 months after starting, 6 months, and a year after. And then we try to flip them into either every other year or every year.
Right.
I'm looking at the coin around your neck. Is that from Syracuse?
This is a Hindu symbol, the Om symbol.
Oh, I see at the head of it looks like.
Yeah. It's meaningful to me. It's either this or I get a tattoo somewhere. Okay. So I'm not a tattoo guy, so I'll probably stick to the chain for a little bit.
Oh, it's cool.
Thank you.
I have a ancient Roman one.
Oh yeah. Yep. It has an ancient look to it. Now, with just talking about DHEA for a second, a few people, I remember even Dr. Drew Pinsky, who had prostate cancer. He didn't say that the DHEA he used caused it, but he definitely thinks there's a connection. So what's your take on the connection, if any, between DHEA and fueling prostate cancer?
Well, first off, we know that testosterone does not cause prostate cancer. It's a myth. Abraham Morgenthaler from Harvard. He was in my first book, and I started bringing him into the organizations to lecture because he is a powerhouse of information, unbelievable. So he gave an incredible lecture on 1941 when they had an error in reading a lab result that set the stage for this being the cause of prostate cancer. And then about 3 years ago, maybe 2 years ago, we had 3 top urologists in one of our courses. One of them's out of Texas, Paul Thompson. They gave an incredible modernized look at really what's going on, and it's called the free testosterone index, the prostatic free testosterone index. So in the prostatic free testosterone index, it talks about the prostate having receptors on it for free testosterone. Right. So the free floating testosterone. When you get free testosterone hooking up with these receptors, you get a healthy prostate. But when you're low in free testosterone, what replaces the testosterone, what goes into those receptors is estradiol.
Right.
And it's estradiol that causes the inception of the genetic processes that leads to mutation and the production of cancer of the prostate. Going back maybe 10 years, there were two major studies, one by the Massachusetts aging male study, and the other one was the Harvard study on prostate and testosterone. And what did they find? They found that men who had the lowest level of free testosterone, when they were diagnosed with their prostate cancer, they had the highest Gleason score. Okay? Right. What that means in English is, prior to getting their cancer, they were measured to have low free testosterone. That was it. And then down the road, in those that had measured low free testosterone and developed having prostate cancer, the level of their PSA was elevated and their grade of their prostate cancer was the highest, the Gleason score, right. 7, 8, 9, 10. So that was a kind of weird group of information, but in discussion with these experts, it turned out where it was the preamble to what we now know about this prostatic free testosterone index being protective. Okay, by having the receptor filled by testosterone, it blocks the estradiol.
Right.
And by blocking the estradiol, okay, that's the setting of the baseline. Now let's look at DHEA. Now DHEA, free floating, not this sulfonated activated form. There are articles that talk that the DHEA can actually upregulate the estradiol alpha receptors. Beta receptors are the ones they think are cancer related. So they think that possibly DHEA can upregulate that. Okay. But let's go back to the beginning. If you're low in free testosterone, then the estrogen has a site to hang out in.
Right.
But if free testosterone is always great, then there's no receptor that's able to get access to that site to turn on the mechanism that predisposes you to cancer, prostate cancer.
Right.
So that's it. And
it shows just the gross misunderstanding that's still omnipresent in the medical community, because they still sing this song of, sometimes they even use estrogen therapy.
Yes.
I was going to say, sometimes they even use estrogen therapy to drive a man's testosterone down even more when they're dealing with prostate cancer.
Well, there was a study that Abraham presented to us, which was absolutely phenomenal. Guys that had, I was looking for a DVD, I'll tell you about it later. There were guys that had PIN, which is prostatic intraepithelial neoplasm. It's a low-grade cancer of the prostate. And what they did was they biopsied them, and then they put them on supraphysiological dosing of testosterone, 2 times the normal level. And they monitored them for years, 2 years, I think it was. And what they did was they periodically got a PSA level. And if their PSA level went up, they biopsied them again. What was the end result? Absolutely no change in the level of prostate cancer. Right. Then the Dannon study, just statistics, that it was 360,000 males who had died from everything else but prostate cancer. Every single one of them was over 70 years of age, and they all had a nidus, which means a little microscopic amount of prostatic cancer. But it didn't create their problem. So they talked about, it looks like, if you get to 70 years of age, the likelihood of the prostate cancer that you have creating, an impact on your quality of life is low. Not non-existing, but low. You know, and that 360,000. It was Dannon Laboratories in Chicago, DANNON Laboratories. So, you know, the mythology that goes behind, you know, the testosterone issue is not testosterone but estradiol. You can argue, well, testosterone converts to estradiol. You know, in an unhealthy person, that happens. Yeah. Someone who doesn't eat well, doesn't exercise, has a lot of body fat on them. You know, all the things that you and I both know and your listeners know because they've listened to you over the years. And you want to stay away from that. But in our last discussion about how important estradiol is to a male, it's all about balance. You know, I have guys that are in their free testosterone levels in the high teens or low 20s, and they have estradiol levels that are twice the normal high.
Right.
And they have zero symptoms. And I tell them, who cares? You know, who cares? You've got so much good free testosterone. And on the contrary, I see guys with that 2 times the high level of estradiol, but their free testosterone is piss poor, which is a medical term, is piss poor, and they've got symptoms, breast, nipple sensitivity, maybe a little bit of fluid retention between their fingers suprapubically or pretibial in the ankles areas where they get fluid retention. And that's because influence of testosterone and estradiol on the mineralocorticoid retention of sodium chloride.
Right.
So basically that.
Yeah.
So
that clears all that up. That's good. Now you wanted to talk about finasteride. Is that how you pronounce it? Finasteride?
Yeah, it's
Finasteride.
Finasteride, Testosterone and finasteride. Right.
Right.
Yeah. You know, for guys that are out there using finasteride to help protect their hair and hair loss, which I personally believe, looking at some of the NIH studies.
One second. Are we going to be using this screen in the middle for anything?
What screen?
Okay, but maybe I only see it on my side. On my side, I still see the screenshot that you put up. Okay, there it is. There it's gone. Now, hopefully, never mind. That's good. That's good. I see you now.
Oh, I was obscene before. It's better to be seen than obscene. What?
I could see you on the small screen before, and I go, it's a little bit better. I don't want to see his face too close up, so that probably.
Yeah, I don't want my face in your face. Right.
Yeah, I don't.
Otherwise, I'll start growing that beard again.
Hey, you look good with the beard. You look good with the mustache too. Not too many guys can rock a mustache. You and Tom Selleck and Don Fry. There's only a few guys out there.
I think that was the reason I was being called Tom instead of Mark. You know. But anyway, my kids, after they say, "Pop, you look so much younger, so much better without." And now they're saying, "Grow it." I'm so old it doesn't matter.
They can't make up their mind either.
Chicks, what can I tell you?
Yeah. You're surrounded by, it's amazing that your testosterone levels are as high as they are, given that you have 4 women in your orbit.
That's right. Yeah, but they're good. They're great kids. Great kids. So anyway, the story about finasteride is it's a product that blocks the 5-alpha reductase, which is the enzyme responsible for the conversion of testosterone to DHT.
Okay.
So as we talked about the benefit of DHT and libido as one of the aspects of DHT in the brain, also it drops the startle response. It helps to decrease startle response in the area of the limbic system, emotional center, which is the amygdala. It helps to modify that and reduce that. DHT, very important. One of the slides that I didn't show you, or one of the articles, was how DHEA and testosterone help to drive DHEA and testosterone help to drive DHT into muscle. Right. So drive DHT into muscle, it's 10 times more anabolic than testosterone.
Yeah.
So if you can get the DHT into your muscle, you get the benefit of peripheral benefits of testosterone. Okay. Yeah. So what happens when you block the conversion both below the neck and above the neck, what you get in the physical is you get weakness in the muscle, almost like a statin kind of response. The people who take statins, they get pinpoint areas of pain through their body. which is
Right.
due to a loss of energy production by the cells, interruption of CoQ10 and ATP production by mitochondria.
Right.
So they get muscle problems below the neck, they get weakness because of the fact that DHT doesn't go into the brain, the DECA issue. What happens is free testosterone has to get into the brain and then converted to dihydrotestosterone that becomes 3-alpha-androstenedione and stimulates all these processes in the brain. But when you use finasteride or dutasteride, it shuts down the enzyme, blocks the enzyme. So you've got free testosterone in the brain, but you don't have the dihydrotestosterone conversion. So you lose a whole pathway of benefits of testosterone DHT, 3-alpha-androstenedione, which on that pathway deals with libido. It deals with libido, erection, sensitivity, emotional stability on one pathway. On
Right.
the other one, which has been missed unfortunately, by people who are treating people with post-finasteride syndrome, is the fact that there's a second pathway that they missed. And that second pathway is where the 5-alpha reductase converts progesterone to allopregnanolone.
Okay.
And progesterone comes from pregnenolone. Pregnenolone comes from cholesterol. So cholesterol, pregnenolone, progesterone, allopregnanolone.
Okay.
Allopregnanolone is what is neuroprotective. The other two are also, but I'll just focus on allopregnanolone because you can look up allopregnanolone and you see all these articles about emotional instability, depression, suicide, anxiety, panic attack, poor sleep, libido-related issues, because when anxiety goes up, your libido crashes.
Oh, yeah, 100%.
Absolutely crashes.
100%.
Think about, the month of March and April are the worst for me because that's pre-tax times. And the anxiety associated with that is just horrible. So, I check out those months. So anyway, what happens is allopregnanolone has become a new drug as of April of last year called brexanolone. The trade name is Zulrosa, Zulrusso, $34,000 a year. You got to go into the hospital and get it IV.
Wow.
IV. And what it does is it helps with postpartum depression, and anxiety. And the added benefits are it increases GABA, so you sleep better.
Yeah.
It's neuroprotective, protects the brain. It's neuroregenerative, helps neurons to regenerate. And it's synaptogenic. Synapses are the communication points between neurons that give us our intellectual IQ, gives us our intellect. It's the ability of nerves to communicate from different parts of the brain, the information it stores. The backside with visual, the temporal with the words, the parietal lobes, and so forth. So it integrates that. So when you have inflammation or a deficiency of these chemicals, these hormones, these neurosteroids, the brain hormones made specifically in the brain by the cells of the brain, neurons, astrocytes, oligodendrocytes, under the direction of luteinizing hormone, just like below the neck. Deficiency of these lead to a deficiency of the hormones that help to regulate a healthy person, healthy in mind, body, and soul. So what happens in people with post-finasteride syndrome is they develop all these symptoms: body aches and pains, erectile dysfunction, libido issues, the whole gamut of it. And because it influences the allopregnanolone, pregnenolone, and so forth in the brain, their anxiety level is through the roof. We've got 42 people that we're seeing right now with PFS, and a consistency throughout them is their high extreme level of anxiety and their libido-related issues. And as we fix things, they get better. I just received my daughter, Allison, who works with me, takes all the PFS patients now. She had a guy that I think in 8 months, he's 80% better. And he wrote this beautiful letter to her, a testimonial letter about how well his life is. And we're doctor number 4.
Yeah.
I mean, on most of the cases, we're, not the first doc people see. And that's good because it's not really the focus. This is a form of chemical traumatic brain injury or non-traumatic brain injury. And we deal with traumatic brain injuries and minimal traumatic brain injuries. You know, the bumper, the rear end things, the slip and fall, the skiing accident, and so forth. But reason why I've started taking more post-finasteride and testosterone cases is because it clearly delineates traumatic from non-traumatic. So they became the prototypical form of non-traumatic brain injury where they haven't had any, IEDs or blast trauma or repetitive gunfire or a devastating motor vehicle accident like the people with traumatic brain injury. But they developed the same chemistry, the same symptomatology, and they get better based on the same assessment with the same approach on treatment. Okay? So, and this is what we see. They are, as a group, a little more challenging because the level of anxiety is so intense, as well as their fact that they've seen so many other doctors. One guy said, I've seen 30 doctors. How are you going to make things any different? And, we do extensive testing, which is not traditionally done. In fact, we had one of the high-end guys that we see about PFS, commented in all the docs he's seen, we do a very unique pattern. And when I explained the reason for each component, he said, that makes sense. So, and so finasteride, durasteride. Finasteride has a short half-life, a couple of days. Durasteride has a 5-week half-life. So, it takes time. So you have to balance, meaning those who are taking these medications for hair protection. You have to balance between whether or not you want to have a functioning brain and body, or you want to have hair and non-functioning. That's the issue.
Well, fortunately, I don't have to make this choice. I've got hair and the functioning. But if I had to choose between one or the other, hey, I rocked a shaved head for 10 years. I could always go back to that. I want the function. I don't want to have a head full of hair and I'm basically impotent.
That's it. Now, one of the patterns that we're picking up, and we just had a national release. I don't know if you got a copy of it, national release on the post-finasteride syndrome, which had some rays of hope in it for people who have been through a multitude of doctors on different forms of treatment. That one of the things that we're starting to pick up is that every single one of our finasteride cases has had a traumatic brain injury.
Yeah.
Okay. And, a lot of them deny it. But when I go and I get into my my mindset, A-type mindset, I start stripping it down into different subsets of trauma. Most people say, have you ever had brain trauma? They said, no, but I fell off the roof, but that wasn't brain trauma.
Right.
I did have someone, a doc who called me, said, I got an 18-year-old kid who has low luteinizing hormone and low testosterone. I said, he's had brain trauma. He says, no, he hasn't. He says, no, he hasn't. I said, how'd you know? I asked him. I said, fine, go back and ask him if he's ever had any below-the-neck traumas. He comes back and he says, yeah, he broke his right leg. I said to the doc, how'd he break his leg? I don't know. I didn't ask him. I said, go back and ask him how he broke his leg. He fell from a second-story roof. Okay? That's acceleration, deacceleration.
Yes.
It's like the guy who was rear-ended at 5 to 7 miles an hour and develops traumatic brain injury based upon the hormone deficiency. It's not to say that his prior head traumas that he had in the past didn't culminate with this being the proverbial straw that broke the camel's back. Yeah. But, cause and effect. And everyone, what's that?
No, it's definitely a factor to look at. I mean, I remember I had a nasty snowboarding accident when I was, not an accident, I just fell over, but I hit my head on a block of ice really hard. And this was when I was maybe 15, 16, something like that. So, I mean, I think a lot of us have had brain injuries. We just don't think about it. Maybe we don't notice a big negative drop immediately after it happens all the time. So we just think we're okay, but it could just be permeating in there and getting worse over time.
Correct. And the literature clearly shows that from 17 years ago, an injury that you had that you stood up and walked away from, the inflammation precipitated by that event lasts for 17 years. So over the course of 17 years, and they did it by these cytokine markers, interleukin 1, 1 beta, 6, and tumor necrosis factor alpha, that they measured these, and they were at levels that were just sky high, okay, sky high levels. And the person enters their doctor's office and says, "Doc, something's happening. I've developed depression. I'm blah, blah, blah." And then immediately they don't ask them about their history of trauma, or they ask, "Have you ever had traumatic brain injury?" The guy says no, but he doesn't include the fact when he was snowboarding and he, fell in his head, or else he does moguls, up in the mountains and skiing, and that constant jarring up and down, or he's doing pneumatic drill as his, or jackhammer as his job, or he's a snow skier or a water skier, or he's been in 4 or 5 minor accidents, Right. All these things have cumulative effects. And another issue is, and I documented in our military, even my partner, Andrew, who told me to say hi to you, and he looks forward to the next time of seeing you across the camera lens.
Yeah. I want to get him on the show next, actually. So I'll reach out to him. I'd love to do an episode with him.
And what we started looking at, and I accumulated in their 21 pages of history, is that every single one of them was playing the sports. Andrew played from Pop Warner all the way to college football. And we've got guys who did rugby, who did MMA, who did jiu-jitsu. A lot of guys did jiu-jitsu. They were jocks before they enlisted. They had that mindset, that aggressive, I'm going to beat shit on those effing people. Right. And so also when they do things, these are all special ops guys that we see. They're a breed above and beyond their own. And it makes sense where one of the guys was telling me he was shooting off a shoulder-mounted rocket, and you're only supposed to shoot maybe 1 every 24 hours. He was shooting 8 a day just to waste them, just to practice and get rid of them, And the blast from that is one of them. I don't know if you've ever shot a Gustav rocket,
No, I haven't.
I'll
add a list of things to do.
Yeah. Well, the overpressure on that's enough to cause you nausea, vomiting, concussion. Boom.
Yeah. One
blast. So the finasteride, the Testosterone, that stuff. It's real, and it's amazing how many years Pfizer, I think it was, that has it. How many years they've been denying the relationship, but it's starting to grow in the number of people, because a lot of them were going to the doc and says, no, it has nothing to do with that medication. It's just because you're fucked up in the brain, your mommy issues, daddy issues, this thing and that thing and that thing and this thing. You smoke weed, or whatever their excuse can be to justify the fact that they don't really understand what's going on with this chemical.
Right. Now with finasteride, what would be a viable option for someone to take it and mitigate the negatives? You just take it concurrently with testosterone, or what would you do? Or should we not take it at all? Aren't there better? Well, why don't we have better options than something like this?
Well, there are options. They're in the peptide range that we were talking about. GSKCU is a epithelial stimulant. It works very well. My daughter just got scratched by a cat a week ago, and I gave her the foam by a company called Tailor Made, which is really neat. And she started putting on a little bit twice a day, and it's almost gone in a week. Yeah, I'm looking for color differences because she's out in the sun. Yeah, looking great. If I can, I think she's here. Get her to show you her covered chest. Anyway, that's one you can put on the hair. It comes in a liquid form, and it also comes in a foam form. Another product to use, which is our labs in San Diego University Compounding Pharmacy, they've got a blend of minoxidil with retinoic acid, vitamin A.
Right.
You need a high dose of vitamin D, because vitamin D stimulates the hair follicles to be healthy. There are studies about vitamin D is very important. Also, you need to look at your thyroid level, because having low level of thyroid, T3 specifically, can lead to coarse brittle hair and loss of the lateral third of the eyebrows.
Right.
Okay.
Right.
So it's not just one approach. You got to look at the whole biochemistry. Zinc deficiency, selenium deficiency, all can lead to it.
Well, do you think hair loss is, if someone has a genetic card for hair loss, there isn't anything they can do about it? Or maybe they just need to optimize all the things that you talked about as early as possible to avoid that genetic proclivity kicking in?
Correct. Well, one thing we know for a fact from all the genetic testing we've been doing is that you can have the proclivity pre-disposal state of having a cancer and never develop that cancer.
Right.
And that's due to things like epigenetics, modulation of epigenetics. Now, you and I know good exercise, good fluid hydration, good nutrition, good supplementation can all influence that epigenetic predilection or predisposal. We know by using women using indole 3-carbinol or diindolylmethane affects the epigenetics for converting estrogen into 4-16 hydroxyestrogens, which are cancerogenic, and keeps it as estriol, estrone, estradiol 2-hydroxy, which is non-cancerous. So we know we can manipulate our epigenetics. We know by smoking, it increases our adenocarcinoma or squamous cell carcinoma of the lungs by epigenetically inducing inflammation, and that inflammation creates the problem. As I said about vitamin D, it's that thread of inflammation, monitoring, controlling inflammation, and that's why there are 1.86 million articles on vitamin D as a cancer prevention, because it modifies inflammation. Why do we get problems? Look at people who have kidney damage from diabetes, cross-linking glycation byproducts. All these things induce inflammation. Alter protein induce aberrations of protein. Aberration protein, if it's DNA cross-linking, inversion, it leads to mutation.
Yes.
So doing the right things, is number one. That's the base point. But if you're not going to do the right things, as I grab my bottle of scotch, what you need to do is have things to compensate for it. Okay.
Right.
So
what I mean, as a guy who drinks scotch, you're a big alcohol fan. What can mitigate the negatives of alcohol consumption? And what do you take to avoid a hangover, if anything, when you go off to Vegas for a crazy trip?
We brought 2 bottles of scotch, 6 bottles of wine. The problem is I never can get drunk. I'll sit there drinking. Can't get drunk. And the reason is all the years that I've been on glutathione, reduced glutathione, and N-acetylcysteine, which upregulates an enzyme in the liver called alcohol dehydrogenase. Okay, I have a very, very high tolerance. Okay, very high tolerance, and it's horrible because it becomes very expensive. You're trying to get a little buzz on.
How many shots or glasses of whiskey do you need before you start feeling something?
About a third of a bottle. And I'll sit there, and the kids find me. When we go on vacation, I usually get a really good book to read, thick book, and I sit by the water in a lounge chair at about 7 o'clock in the morning with my bottle of 18-year-old Chivas Regal, and reading the book. And the girls come down 9 o'clock, 10 o'clock, and they come down, they pick up the bottle, it's empty, and they ask me what I'm reading. I explain what the science fiction I read is, and they said, "What do you want to drink?" I said, "Get me a double mojito." So I'll change over from scotch. But, I'm not bragging about it. It's probably a very bad kind of mentorship or to emulate, so you guys out there.
Fun in this life, though, right? If everything is like, look, I want to be as optimal as possible and feel great and so forth, but you got to blow steam. You got to have something where it's a divergent path. That's why I like going gambling. It's something totally different.
Yeah. So here's the negative of alcohol. We know that alcohol, and that's why I'll have maybe 4 ounces on a one day during the weekend with food, as opposed to in the past it would be 3 days a week with a half a bottle of scotch with an in-law or a buddy comes by.
Right.
Don't drink. Privately, I'll tell you about what happened in England when Andrew and I were there partying with the SAS.
Oh, really? Okay.
Oh, yeah. So what happens, alcohol shuts down growth hormone production in the brain.
Right.
So one of the problems that you have to deal with is alcohol's influence on the hypothalamus production of growth hormone releasing hormone to stimulate the production of growth hormone in the brain. In the liver, it also disrupts all the hormones. Now, you remember that growth hormone, the organ that the growth hormone that's produced between 8 at night and 4 in the morning goes to elicit 75% of its effect is on the liver. Growth hormone turns on the liver to produce 9 proteins, one of them being IGF-1, which is an incredible hormone for repair, cellular repair, protein synthesis, and then IGF-2, and then all the binding proteins and a last thing called acid-labile subunit. Messing with the liver metabolism leads to a loss of IGF-1 in the growth hormone parameters. Dealing with testosterone, it alters the metabolism, appears to accelerate the metabolism of free testosterone to byproducts of testosterone. Remember, total testosterone is worthless, absolutely worthless, because you have to look at the literature and what it represents. Epitestosterone, dihydrotestosterone, estradiol, albumin-bound testosterone, free testosterone. 2% is free testosterone. Right. So whatever your number is for total testosterone, take 2% of it, and your free testosterone should be at or above that number. If it isn't, it means that your free testosterone is being converted to other things. Right. What are those things? Selenium deficiency can cause you to have excessive conversion of testosterone to dihydrotestosterone. Also, having high levels of 5-alpha reductase can do that. Having low zinc increases the conversion from testosterone to estradiol. That's why we like to have good levels of zinc in our system.
Right.
Okay. It's involved in 300 processes, anti-COVID being one, or anti-replicase being one.
Yeah.
So we have to incorporate minerals into our nutrition in order, specific to help with certain of the hormonal transformations and productions in our system. So the liver, and the liver is an incredible site for detoxification, transformation, or metabolism and production. So alcohol disrupts all 3 of those avenues. So what do you do to protect it? You don't drink. That's really
most part.
What's that?
That's what I do for the most part. I'm more of a THC guy, if anything. But alcohol, I used to love drinking when I was younger. I used to love it. I still like it now. It's fun. It's fun to get together with friends and have a few drinks and have a great conversation. That's why everyone does it. It's fun. But it seems that when you're training 6 days a week and you have these performance goals and so forth, anything that takes away from that starts becoming less of a priority for me when I'm in that state.
Yeah, that's exactly right. You have to prioritize your goals. Is your goal getting drunk and losing the gains you've had for the years that you've been working out so diligently on quality body?
Yes.
That's what you have to do.
Right.
Is it worth going from a democratic society to a communist socialistic society? These are the decisions in all aspects of life. You have to look at contrast between which one's the better for you.
Well, we look at any communist socialist society, current or past, we should know better. That thinking that that's a good direction to go in. It's ridiculous that.
What do they say? Those who forget to look at the past will repeat it.
Yeah.
Yeah.
No doubt.
I think that was Churchill. Was that Churchill? No.
It starts with censoring of points of view in language as well. It starts there as, okay, this is a public safety. We're going to cancel people that we think are toxic. We need to marginalize them, get them out of it. But then who decides who's offensive and who isn't? Mm-hmm. We have a committee now that every time you post anything, a committee is going to come in place and say, okay, this is offensive. So now we're going to marginalize you. It's scary. It's scary that so many people don't see that. The domino effect of a cancel culture type mentality. And they're thinking, well, this is how we marginalize racists and so forth. And I go, well, look, I'm not a fan of racism, but free speech, either we have free speech or we don't. So along with free speech is you're going to hear things that you don't like, but people have a right to say those things. And then you have to challenge those things. But everyone has to have a right to say whatever they want to say. And then what we need is way more honest dialogue anyway. So if we're going to have any discussion on racial relations, we need to have really honest dialogues between people where it's going to be uncomfortable conversations and people just have to give others a little bit of leeway. But that needs to happen. Otherwise, it's just suppressing. And what's that going to do to a society ultimately? It starts becoming, we don't want people focused on hormone optimization anymore.
That's the purpose and persistence of the mask, because the old adage or the old statement is read my lips. Well, if they're covered, you can't read their lips.
Right.
So you don't know what the fuck they're saying, But yeah, the right things will always be the right things.
Right.
Right. That's it. I don't need to say anything more about anything. The right things are always the right thing. Andrew and I, in the path that we've been working on, it's doing the right things for the right reason. Okay. Yeah. And you've got to look at the secondary gains that are out there. And that really will tell you what the truth is.
Oh yeah.
Yeah.
No doubt.
It's depressing. It's what's going on with COVID, the politics, world peace and free, carbon footprints and all that stuff. It's just overwhelming.
Yeah, so it is. It's very chaotic out there, and you can see it. You can see the stress on people's faces when you talk to them. I mean, it's palpable. You can feel it in the air. This Twilight Zone type thing. I'll tell you a funny story. Our hot tub broke down, right? So the jets aren't working. So I hired this company to come over, and they just show up at 8 a.m, no real warning. I'm like, okay, that's all right. Allows me to get this out of the way. So this guy goes back and he looks at it and he tells me, he goes, okay, you need this panel replaced. I'll go back to the office and let you know what the cost is going to be. I go, okay, great. Sounds good. And then I get a call from who I think is his wife who runs the call center. And she said, oh, you know what? I forgot I didn't ask you that whether your jacuzzi is above ground or below ground, and ours is above ground. She goes, we don't work on jacuzzis that are above ground. I go, okay, then why did this guy come over here and open up the hot tub and look at the panel and tell me what needs to be fixed and that he's going to give me a quote later? He should have just seen the hot tub and said immediately, hey, we don't work on those, or so-and-so should have asked you that. And then he's on his way. I go, in Las Vegas, you deal with really stupid customer service issues like that all the time.
Wow.
But that one boggles the mind. I still don't understand what happened there.
Well, wouldn't you think before they came out, they would ask you the question so they didn't have to go out?
Yeah, exactly. It's a waste of their time. It's a waste of my time. But even the second he saw the jacuzzi, why didn't he say something? The second he saw it, he should have said, you know what? We don't work on these. So-and-so should have asked. But he still took the time to take it apart and look and fiddle around inside and then tell me what the solution is. But now they're telling me that they can't execute the solution and take my money, because I'd be happy to give it if they want to fix it. So I don't get it.
So you've got a hot tub outside in Vegas.
Yes, I do.
When do you use it?
I use it at night. It's amazing.
How cold is it getting at night?
In the summer, it's nice at night. Even now, it's a little bit of a breeze. It feels great because you sit in the hot tub for 20, 30 minutes, and then when you get out, you're not remotely cold. You walk inside the house, take a shower. It feels good.
So what temperature do you keep your hot tub?
I like it at 107. I like it really hot.
No way. 107?
Yeah, and I can tolerate that for 30 minutes, no problem. But that just gets... And then I take a cold shower afterwards just to kick the fatigue.
Just a little shaker. Yeah, a little earthquake.
Oh, really? Does that one out? Wow.
Yeah. I heard it, and then a little shake, and my coffee's... That's all right. Not too bad.
Yeah, but the red light therapy, I've got red light therapy panels. I use those just about every day. I lie in front of it for about 15, 20 minutes. I love that. I use the jacuzzi.
It's infrared?
Yeah, it's an infrared panel. I mean, the hot tub is not infrared, but I have a separate infrared panel that I use as well. I use that on a daily basis. I use it before training often to just activate mitochondria and just get the energy levels up. And it is a noticeable difference. Now, some argue that it increases testosterone and growth hormone. That I don't know anything about. I don't know if it, at least in my case, I don't know if it has that effect on me, but it has other benefits that I think are worth it.
I haven't looked at it from a hormone standpoint. Guys who teach me about detoxing using infrared or red light therapy, infrared, along with celery tonic and couple of lemon juice, celery, and a couple of other things, which help to reduce.
Charles Poliquin turned me onto the lemon juice a while back, or lime juice. So I squeeze a lime into about 12 ounces of water, put a little bit of sea salt in there, and that's the first thing I take in the morning just to cleanse and hydrate. And then that feels great every time. It really hydrates you, so you're ready to go.
Is that another shake?
Wow.
Yeah.
We got this on tape too. So if anything,
we'll find out. Yeah, I go and click into California Earthquake Center, and they'll show you what the magnitudes are.
We feel those over here sometimes, honestly. It's really subtle, though, but you feel it. You just a little bit of shake.
Just a little one. I wasn't dancing, so, it's got to be something else.
Let's talk about your products a little bit before we wrap up. So you've got awesome products. I used the latest ones you sent over for brain health and so forth. And I actually went to buy some last night, but I guess your website is not set up at the time of this recording, or maybe it is now. This was a day or two.
No, it says clearly that September 14th is when we launch. There's a date. Yeah, there's a date in there. Otherwise, it's either on our Amazon account, which will slowly disappear, and at our office always is available. Okay. I'll talk to you about that after we stop recording.
Yeah, sure.
The product line that we have, which consists of 3 key products that we use in traumatic brain injury, were all developed over 16 years for the Brain Care 2, which has 6 components in it, which through that epigenetics helps to drop down the inflammation that's in the brain. I talk about the brain and don't disregard the below the neck, because we've had people with chronic arthritic conditions who, when they start on our protocol with this one product called Brain Care 2, their peripheral joint problems improve too. And that's because the mechanism in the brain and below the neck are basically the same mechanisms to alter the inflammation that's produced. So Brain Care 2 is the name of the product. It was released in May of last year, and we sent it over to one of our military bases in Kentucky with medics, and we gave it to them to 2 products, CME, Clear Mind and Energy, which I'll circle back to, CME and Brain Care 2, and they went on it for 90 days, and they had a 50 to 70% improvement in their overall quality. And they ended up, 2 of the guys, Doug and Mike, and medics, ended up introducing me to one of their buds, a doctor from when they were out in Afghanistan, who happens to be in politics, a major politician. So now he's looking at what we're doing. We've communicated a couple of times. So that's good. And Clear Mind and Energy was the first product that we developed. That took 8 years to develop. It went through testing for 4 years before we released it in March 2017 to a major SEALs team. And CME, Clear Mind and Energy, was built to help guys and gals get off of methamphetamine, dexamphetamine, Ritalin, Cylert, caffeine tablets, Red Bull, 5-Hour Energy, Provigil, Nuvigil, cocaine hydrochloride. And we have a couple of cases that got off their combination methamphetamine, dexamphetamine, which is Adderall. A gal who was on it for 5 years stopped it 2 weeks after being on it.
Just a quick interjection. What do you think is the negative of continued modafinil use or Provigil?
Great question. All of them that modify the neurotransmitters do so by either replacing your own, or stimulating your own, or increasing its ability, your transmitters, a grouping of them, neurotransmitters, to last longer at the synapses. Like what's a great example is L-Dipronil. which is also called Sledgeling. Great product. Great product.
It's great.
Yeah, it's a nootropic.
Yep.
Our products, we don't call them nootropics, but I think we're expanding to include nootropics because the effect is like, wow, okay, on cognition.
Oh, yeah.
Yeah, so Clear Mind and Energy, I used to use it daily for a couple of weeks, and then I stopped because I realized I wasn't drinking my double espresso in the morning or my double espresso in the afternoon. I found I didn't need that boost. It was lasting 12 hours. I take mine, I go to bed at 12 and I wake up 4:30. Late days is 5 o'clock in the morning. And like this morning was 5:13 I woke up. And 5 hours sleep is all I need. 1% of the population need very little. Or if you improve the chemistry of the brain to function at a better level, that's the nootropics. What happens is you recover and regenerate a lot faster. So that's CME, and then Brain Care 2. And then the one that came out in February that I'm in dialogue with a camp commander, one of the military bases here, to get 100 of his guys together to do a project with them. Brain Care, B is for Brain is the latest one, came out in February. It is 6, all our products have 6 components in it to keep it simple so you can read about them and understand how they work together. A lot of the products have so many products in it, you don't know which one is creating the benefit.
Yeah, right.
It's all confabulated. It's all, confused and spun together.
Yeah.
So these, and we have data sheets. I think I've sent you all our data sheets, which enumerate each one of the components and what they do.
Right.
And on the website, we're building it. So, the Shopify site, it has the articles that substantiate the benefits. And over 1 million articles are what are in our collection for each one of the for the products. From 18 products is about 1 million articles. So I've gone through 50 to 120 of the articles on each product so that we have a great understanding. That's how I built these products. So anyway, the last one, B is for Brain, has B1 and B2 in it at therapeutic levels. And that's the key. Therapeutic levels. You don't want to just have 1 milligram when the range is up to 300 and say, oh, we got thiamine in it.
Right.
We've got B2 in it, riboflavinoid. Well, B1 and B2 are extremely important in the brain, and they've been talked about, and syndromes have been labeled Wernicke-Korsakoff dementia, which is from B1, B2 deficiency. It has also in it B6, pyridoxamine hydrochloride, and it has methylated B12. Those are the 4 of the classical B vitamins. And then we throw in 2 new B vitamins, one called CoQ10 and PQQ, which upregulate energy production in the brain, also below the neck, but I focus on the brain. And as free PQQ is 100 to 1,000 times stronger than CoQ10, increases the number of mitochondria. Only 2 natural products do that, or 2 natural products that do it very well. There's resveratrol, which does it poorly, and there's quercetin and PQQ. They upregulate epigenetically, they upregulate something called SIRT1 gene. The SIRT1 gene increases production of mitochondria. Let me correct my misstatement. Nitric oxide is also one that greatly increases mitochondrial replication, mitochondriogenesis. So resveratrol, nitric oxide, quercetin, and PQQ increase the production of mitochondria. So the more density of mitochondria you have in the cells, the more you have to feed them correctly, and the more energy you produce, so the more energy you have to expend. My daughter took the B is for Brain, and she had a terrible habit of just tilting her head back and squirting the product to her mouth. And I'd say to her, how do you know that is 1 teaspoon? She said, she, cupped her tongue and said, oh, that's 1 teaspoon. I said, half an hour later, she comes running down the stairs, fully dressed to go to the gym. I said, where are you going? She said, I got to go to the gym. I said, what happened? I've got so much energy. She disappeared for 2 hours. I did a bike ride this morning on Clear Mind and Energy and B is for Brain. And 20 minutes after taking it, I said, I'm on my bike. So I'm up in the mountains, so.
Your products, yeah, they're great. I would take them first thing in the morning. I would take a second dose before working out. Yeah, you have great stuff. Definitely,
Yeah,
definitely.
you're just like Andrew does the same thing.
Yeah.
Yeah, and it once a day, 12 hours it lasts. But I don't need any extra, okay? Because all the other stuff, I don't need any extra. So anyway, we have all the products that I developed from Dinotropin, Secretropin, Brain Care 2, CME, Clear Mind and Energy, and B is for Brain. All the proceeds, about 60% of the actual price of them, are all donated to our veterans program. So we're self-funding. We've processed a significant amount of funds, about $3.28 million into our veterans program. Some of it, about $500,000, came from donations, but the rest of it, about $2.9 million, came from the sale of our products over the 5 years that I've been working very closely with Andrew and Warrior Angel Foundation. And it's, reading the results, seeing the results, reading their monthly reports. It doesn't matter how much money I put into it. I just need to have enough to pay my rent. And, scotch I don't have to buy because everybody gives me scotch, knowing that they think I'm a lush. So I've got shelves of it.
Your biggest expenditure is taken care of there.
Yeah, well, yeah, that is. But anyway, the benefits are there. On the website, we'll start populating it with some of the testimonials. So I'm not a great believer. I shouldn't say believer in testimonials. I like what they say for me, but I don't like using them to convince or sway anybody else to consider using it, because each of us is so different in how we respond. I don't want to tell you this person had this response and therefore you're going to get that or better.
Yeah, I see what you're saying. That's a line. At the same time, though, people get excited when they see other people's results. Right? Like my natural testosterone booster sells so well because I've got 100 testimonials on the page, and these are not.
Is one of
you're a testimonial for EC, my estrogen control product, and that's much appreciated. But my number one selling product is my natural testosterone booster, and that has, at least 100 testimonials on the info page. And I can actually add more because I get testimonials all the time. People's before and after blood work type testimonials too, so very specific. And then I mean, nothing works for everyone. So I just offer money back guarantees. That's all you can do is try it. If you get great results like this, great. You're going to keep using it and tell other people. If you're a non-responder for whatever reason, no problem. We'll give you your money back and we move on.
Yeah, I fortunately haven't seen that yet. Okay, that they haven't had it. And one of the reasons is I have in my clinical practice the ability to spend 16 years developing Brain Care 2 and have 4 or 5 years of people in the clinical practice using it and allowing me to manipulate the composition.
Yes.
And, so clinical. So everything we have has been clinically tested, proven, used, and the people come back saying, man, what a big difference.
Yeah.
That clarity, crystal clarity.
Yes. Yes.
Yeah.
Go ahead. That just improves every part of your day when you're that focused, when you're that dialed in. And a lot of people need that right now because a lot of people don't have any purpose for a variety of reasons. But sometimes you don't have purpose because you don't have energy. So when you're tired all the time or you're fatigued all the time or you can't concentrate on things, it's hard to develop a passion or a purpose. And once you have those things dialed in, all of a sudden it's, okay, let me go to the gym. Let me start reading this book. Let me start writing a book. All of a sudden these passions and purposes start manifesting.
Yeah. Last week, I don't want to remember what drove me to only sleeping 3 hours. And I woke up at 3:39 in the morning and started doing my work, because once I'm out of bed, it's very difficult for me to stay there and toss and turn. So I just get up. But it was a lot of stress from all the shit going on, the political, bad mouthing each other instead of talking their platform, regardless of which side, COVID shit, this, that, and the other. And then buddy Rick Drayson, I don't know if you knew Rick Drayson. WFA, yeah.
It's familiar though, yeah.
Yeah. Anyway, he passed on Friday. But, just everything culminating, and I only slept 3 hours. And I said, okay, I got tired again. So I went to bed, and just as I laid down, my alarm went off. So I'm feeling like shit. I go into the shower, take my shower, and I'm driving to the office. It takes me 25 minutes to drive to the office, and I'm feeling like, oh my God, I'm gotta fall asleep. But as I got to my office, I woke up and worked for 12 hours. Why? At 5 a.m., I took my CME, Clear Mind and Energy, and B is for brain. And it took about an hour and a half, 5:30, 6:30, about 7 o'clock. And I was just crystal clear and sat there and processed 4 or 5 reports, medical reports, and, called up some people. And I lasted 12 hours, just crystal clarity, energy. And it felt like I had a full night's sleep. No crash on it because there's no added caffeine. It's got green tea. Right. On the website, there is access to our data sheet, which has all the components and what each component does in each one of the products. And then they can go to our, one of our older websites, dhpusa.com, and read testimonials and get a copy of, the data sheet. So it's across all the platforms that we have. Yeah. But anyway, they're doing very well. Have to remanufacture them every 3 months now. They're doing that well.
Yeah, that's really good.
Yeah, it's good. And it's good because right now we've had a lot more. I mean, when we first met, I think I was having 10 civilians to 1 military.
Right.
Now I'm having about 2 military to 1 civilian.
Wow.
Unbelievable. And this year was phenomenal in active military coming on board, from the SEALs, from this group, that group, and whatever else, coming on board because people they know that were medically boarded out, telling them about the work that Andrew and I are doing, and they're cycling to Andrew, and then they're coming over to us, getting on a program and doing extremely well. One of the cases that just blew me away was a guy in North Texas in Dallas area, whose wife called me, in fact, for the original connection, because her husband was incarcerated or in jail, in local jail, for disturbing the peace or whatever it was. He got out. I said, the first thing to do, get him out. We got him tested, got him on program, gets into another squawk, and he gets out, and he's saying how badly he feels and so forth. I said, just get on the protocol. He's got the protocol. Stay on the protocol. Just hold tight on it and trust in us. A month later, he sends his MPQ, which is a monthly program questionnaire where they fill out questions and they score themselves in 25 areas. His score was 0. Not this Monday, a week ago Monday, I get his second month, 60-day MPQ monthly program questionnaire, and it had 8 on a 10. I said, this guy must be filling it out incorrectly. He doesn't understand how to fill it up. Right. So 6:30 in the morning when I get to the office, I see this, and I call him in Dallas. And I get Luke on the phone, and I said, I'm calling to make sure that you filled this out correctly. And the statement you made, you're off all your medication as of 3 weeks earlier, and blah, blah. He says, absolutely. I'm feeling great. And his wife, Karen, corroborated it, is doing really well. And he scored an 80% improvement in 2 months. Wow. Which usually for us, it's 50% improvement in 3 months. Yeah. Yes, we do get some people who improve greatly. And I think what's contributing to it is this new group of core products, which are the tri-pack, these 3 products. They just, when you've got a functioning brain, you function.
Yeah, absolutely.
That's it. So anybody out there, we have a new website that'll be launching on the 14th of this month, which is millenniumhealthstore.com. And what I will do is I will send to you, Mike, a checkout passcode.
Yeah, a coupon code for a discount. Yeah.
We call it a peacock, which is a patient checkout code. Okay. Yeah. So, but I will send it to you, and you can distribute it amongst your people. And what will happen is it'll give them a $20 discount on the pack, on the tri-kit. Just on the tri-kit, it'll give them the discount in case they want to try it out. And what we're doing right now is we're looking at patterns of use. It was launched daily use. And now what we're finding is people start with a daily use for a week, 2 weeks, and then they flip into every other day. They get the same benefits because the accumulation of the beneficial effects here in the brain with the drop in inflammation is so persistent. My daughter does it, 5 days on, 2 days off, and gets the same benefits over the 2 days.
Right.
So we've been working with combinations. We'll eventually have single serve packs with the blends together. That's what we're working on now. And so trying to keep the price low, but the price points so that we can help more of the veterans. And now that we're getting so many more in, this is why we started the Shopify and getting it out there.
That's what people need to realize as well, is that 25% is going to help people in need. And so you're not only are you getting great products to improve your own well-being, you're supporting a cause that all of us should be supporting. I mean, few things are more important than taking care of people who put their lives on the line.
Absolutely. I get frequently asked, because I'm a civilian, never been in uniform. They say, why are you doing this? And, the real story is about the NFL being so difficult and so bad to work for. I said, if I was going to do my services for free, I might as well do it for someone who earned to get it done.
Right. Right.
So that's how in 2009 I started with the military, and then Andrew came in 2015. But I tell the guys that, I might not have served our country in uniform, but I serve those people who have served, who are serving, and that's really what it's all about. We have what we have. We have what we have because of them.
Absolutely. 100%. 100%.
That's the way to give it back. So anyway, thank you very much again for this opportunity to share some abstract thoughts and some concrete practice.
Another 2 hours of great content here. So we've got a lot of good material. I appreciate it. And so we got the website discussed. So I guess there's nothing to plug right now. What about Warrior Angels? Where can people go to make a donation? Is it just it's waf.org, right?
It's waftbi.org. We have a campaign. What I'll do is I'll send you the hyperlink to it. What we're doing is I've been writing a grant for the Department of Defense, and it's so much bureaucracy that Andrew and I decided that we're going to try and fund it ourselves. So if we can get the funding for running this 100 veteran program, to put them through this program, it would force the DOD and VA to look more closely at what we're doing, because it's a blinded study. They will take it more as being just stories, what do they call it? Anecdotal.
Is there a precise fundraiser you're doing?
Yes, there is, and I'll give you the link to it.
It's not just a general donation. If I want to contribute to this, is what I'm saying. Is there somewhere I can go specifically to make a donation?
Yeah, it's through the 501(c)(3). It's a different pathway for this. Okay, and honestly speaking, if I get the grant, this money will be used directly for veterans who are not in the program, for help like we've been doing in the past.
Fantastic.
The grant, Andrew takes no money, I take no money for it. It's just to pay for the treatment, whatever the cost is of labs, whatever the cost is, that's what it's paying for, so we can get small amount of money to get it done. The government grant is up to $3 million. Wow. If we collect it ourselves, if we do it ourselves, it'll be about $1.25 million. Okay.
Yeah. Fantastic.
And so I'm not getting any money on either the grant or what. I've written into the grant application that I'm taking zero money, that he's taking zero money. The only thing it's being used for is to pay for labs, our consultant, our manager, who we have to have a manager for it, and for our statistician, which is about $35,000. So, people to do it. Okay. and to do it, and also all the supplies, cost. That's all it is, or free. So to get it done. So I'll send you that link for the new GoFundMe or wherever Andrew does it.
Yeah, I definitely.
He's a 501c. I'm a consultant to them. I don't have any ownership or anything to it. My disclaimer to it. So I have nothing. It's really crystal clear that what he does is based upon what he does, and he's done a great job. And we know that because we now have 353 guys. And I know you got a copy of the 459 participant report, civilians and military, last year, the 2019 report. I think you got it. If you didn't, I'll get it to you. You did get it, yeah. Shows the graphic results. And the results, no one is able to come close to it. And they're off their medicine. They're off their medicine. They're in school. I just got an email from, I think he was Navy. He ended up getting into Loma Linda in physician assistant school. And before he started that, he came onto our program and was able to apply and get in through the veterans system. And he just graduated, and he sent me a video link of his graduation. He says, go to minute 38. And he says, this is what you did. So I go to number 38. He graduates straight A, valedictorian with the Presidential's Award.
Wow.
And this is a guy who, if you looked at his medical records before, you saw the challenges he was up against. And we have guys dual degrees out of Harvard, MIT, University of Chicago, just all over the map, doing what they said. I couldn't do it. There was no way. So I know the system works.
Yeah, it's amazing. No, you guys do incredible work. So I'll definitely not only donate to that GoFundMe page, I will disseminate it widely, and let's see how much financial power we can add to this thing and do some real good.
Okay, thanks. Appreciate it. And, we've got admirals at the Pentagon. We've got people in the White House. We have congressmen now in 3 states. We have a lot of bases that have invited Andrew and I in. More coming. COVID sort of like shut things down on us. Right. Let's see, the movie, Quiet Explosions. You need to talk to Andrew so he can get you a link and talk to
this week and get him on. Absolutely.
And talk to him about getting access to the link. They're going. The movie was picked up by a distributor, and they're going to launch it in October.
Oh wow! Okay. Is this going to be a theatrical release, or is this going to be an Amazon Prime, Netflix type release? Do you know?
I was just a bit actor in the movie, in the documentary. And as far as all that, it's not what I'm involved in. I was just, participating at levels.
If it's going to be the support it. Yeah, I'll ask him. I'll reach out to
Andrew and Jerry Shear, the writer, producer, director, Jerry Shear, brilliant lady.
Oh, that's great.
Yeah, and the movie won the Northwestern in Washington won the award. The award, and it's the first time they've asked for a second playing of a movie.
Wow.
I forgot what it's called. It's a film festival, Northwestern Film Festival. Yeah. So very impressive. Very impressive.
Yeah, very impressive, very well deserved, and looking forward to seeing that.
Yeah, absolutely.
Well, this has been awesome. Yeah, so I'll stop recording so we can have a real conversation about it. But Dr. Mark Gordon, you're the best in the business. It's always a pleasure to talk to you. You're super knowledgeable about not just hormones, but so many other things regarding health and fitness. It's a pleasure. So I look forward to talking to you again. And let me just hit stop recordings to make sure we don't lose this great episode.